All right, so just how prepared are we when it comes to a rollout of a vaccine in South Africa? Let's find out. I'm joined by Shabir Madhi, a professor of vaccinology, as well as a member of the Ministerial Advisory Committee on COVID-19. He joins us now live. Prof, thanks for your time. We appreciate it. I think many South Africans are asking this question. We see that there's a rollout of the vaccine in the UK next week. The US is also pushing for one. When do we get it, and how does that process unfold?
So good afternoon to you. So the reason why the UK, the United States, and a few other high-income countries have been able to start implementing vaccine as soon as next week is those countries have actually entered into bilateral agreements with the companies that are manufacturing these vaccines. And in essence, what they did, they put in an advance purchase order to gain vaccine as soon as it becomes available. Unfortunately, the reality that we face is that much of the initial vaccine that is going to be manufactured by Pfizer, by AstraZeneca, as well as by Moderna during the course of this year, which is not going to total more than 300 million doses, has already been procured by high-income countries. So it's unlikely that South Africa will gain access to any of that vaccine, at least for the first quarter of this year. In terms of how successful we will be to get vaccine come 2021, it largely depends on government and how successful it's been in engaging through the COVAX facility, as well as directly with manufacturers to gain access to the vaccine. The problem that South Africa currently faces is that it's classified as an upper middle income country. In terms of the COVAX facility, that would require for us to actually pay the full purchase price of the vaccine with a markup to subsidize the lower income countries. And unfortunately, that model inadvertently doesn't assist us in terms of getting adequate quantity of vaccine at an affordable price over a short period of time. In short, I think South Africa will be if we get vaccine in South Africa by the second quarter of next year, that would be a major achievement right now.
So, Prof, let's talk about these localized lockdowns. And, of course, it's not really the correct terminology because we're just seeing stricter measures being put in place in hotspot areas. We've started off with Nelson Mandela Bay, but there are concerns about several areas in the Western Cape, in particular the Garden Route. The minister was visiting several areas there. When do you recommend that they actually move into stricter measures despite those increase in infections?
Yeah, so I don't think there's any room to go to higher levels of lockdowns. The single most effective tool available to us at this point in time to try to minimize the resurgence at least to prolong the resurgence in terms of when it comes and the magnitude of it is not to allow for mass gatherings. For as long as we continue allowing mass gatherings, especially in indoor, poorly ventilated areas, it shouldn't come as unexpected that we're going to see this sort of resurgences take place, not just in the Garden Route, but very soon in the Cape Metro itself and in other parts of the country. So at the end of the day, we have got limited sort of tools available to us to be able to prevent the resurgence, and in essence, we can't prevent the resurgence. But what we can control is how soon that resurgence is upon us, as well as the magnitude of the resurgence. And as I mentioned, the best weapon against that is not allowing for mass gatherings, and even allowing for 50% occupancy in an indoor, poorly ventilated area. That does not help us in terms of avoiding or trying to minimize the resurgence.
All right, Professor Shabir Madhi, thank you for that. I am going to leave it right there because I'm struggling to hear you, but we do appreciate your input on this story.